I'd like to welcome Dr. Kate Farner. Dr. Farner is a doctor of physical therapy and has specialized in orthopedic and vestibular conditions with a focus on fall prevention for the last 13 years. She's also the clinic director and co-owner of Proactive Physical Therapy and Sports Medicine, and she's a member of Altura's Upright Advisory Board. Hello and welcome, Dr. Farner. It is wonderful to have you here today.
Thank you so much. I'm so excited to be a part of this.
Wonderful. So, Dr. Farner, in your experience, as we get older, we can start developing chronic pain and end up reducing our physical activity for fear of more pain. So, how can we stay active and mobile while managing that chronic pain?
Yeah, chronic pain is such a complex issue for anybody that's ever experienced it. And it includes so much of the mental, physical, and definitely an emotional component to things as well. To stay active and encourage others to do the same, we really have to find our why. What's our passion? What's our thing that we want to get better at? If it's a short-term goal, a long-term goal, that's the important kind of first step when we go through this. Exercise includes, endurance stuff, strengthening, even some balance tasks that can be made specific, but the most important thing is to make them individualized for the person. Cookie cutter programs typically do not do well for this patient population. People with chronic pain need to be able to start slow and really small and be able to listen to their body to tell them if it's too much activity or not enough activity and see how they feel overall. The key with these is usually progression. We need to kind of challenge our body to grow. So sometimes there's change that's involved. That's how we kind of improve on our physical ability. We could consider like an actual patient in this scenario, something like somebody with joint arthritis, which a lot of us have, older populations and even younger populations as well. I typically talk to them about low or moderate intensity exercise that would improve their strength and endurance and balance. But the most important thing is being able to do all of those things without increasing their pain level. Examples of this could include like pool workouts or bowling, golfing, even walking with friends. And most biking activities do really well here. Each of these could kind of address all the impairments that they have without increasing their pain level, but also can act as a social event to bring their community and their family members around them for support. In this instance, I would always recommend that they have at least a discussion with their healthcare provider about how to start, how much they should be doing, how to change things up, and how to make it a little bit harder for them when they're ready.
That's great. I love that. Find your thing, find what you're passionate about, and even make it your community. So many individuals also experience fatigue or chronic tiredness that affects their involvement in exercise and social events. So how do we increase our energy level?
Yeah, you'll often hear the statement like people that exercise regularly have more energy. And it's such a hard and complex kind of concept to understand because it seems like it would always be the opposite. There are several factors that contribute to our energy level and overall fatigue levels during the day. These can include anything from stress to sleep quality and even quantity, how much sleep we're getting a night, any medication side effects, our general health. But some of the things that we can really control are even maybe how much water we're drinking and what our diet looks like as well. Exercise can usually trigger a host of bodily functions that help boost our metabolism and our hormone levels, both of which increase our energy level. But exercise also can help with our sleep. And eating 5 small meals a day rather than the 2 or 3 big ones, which is our typical social event or when we eat with family, but also making sure we're drinking enough water can have considerable effects on what our fatigue level looks like and just overall how we feel on a day-to-day basis. When we feel better, we tend to have a little bit better energy as well. The biggest takeaway I can always say with boosting energy level is just pick something that you really enjoy doing and get started.
That's great. And I agree about staying hydrated. It makes all the difference in the world.
Yeah.
And then finally, mobility aids can help us stay mobile. So when should we think about adopting a mobility aid, and what are your recommendations for choosing one?
Yeah, there's an abundance of mobility aids or assistive devices on the market, which is great for options, but sometimes a little overwhelming too. We can consider canes, walkers, or even rollators that can be used at different stages of our recovery path or health. And you may need to use one or more than one at some point during that journey. Which one you need is a big question and will depend on what your current health condition looks like, your lifestyle, if you've had any falls, and even what your needs are for getting around mobility wise. But you also need to probably consider one that's maybe adjustable and easy to transport, especially if you're going to use it outside of your home in your community. The signs usually for needing a mobility aid could include a recent fall or just overall trying to prevent a future fall, lower body weakness, an unsteady gait, decreased endurance, or just in general overall difficulty walking. I will usually say that if you're having trouble getting around or you're noticing that you're doing less activity during the day because it's difficult to get around, it may be time to consider some type of mobility aid to help improve your function and independence. There's always a stigma around using a mobility aid, and we need to really make sure that we don't focus on it as a limitation or a label that could kind of highlight impairments or weaknesses, but focus on how it can help us do the things that we want to be able to do and do them longer and more independent. Usually the discussion around use of a mobility aid, my biggest recommendation is to start it a little earlier in our healthcare journeys and make sure that we're talking with our healthcare providers, family members, and caretakers, but most importantly, what we're going to want to use and what we're willing to kind of take on. When we do that, we determine which one is the best for us and keep us independent longer and doing more of what matters to us.
That's wonderful suggestions. So appreciated. Thank you so much, Dr. Farner, for joining us today, sharing your expertise, wisdom, and all these amazing details with us. And so for even more information, you can refer to your provider's website or contact the Upright team at upright@altura.health.